Hello and welcome to The Virus. I'm Jeremy Fernandez. There's been another delay to the return of cruise ships to Australian waters. The government's today extended the ban to April 17th. It was due to be lifted next week. Some of the most significant turning points in the early days of the pandemic involved cruise liners. Way back in February of 2020, just as we were learning about coronavirus, there was the Diamond Princess docked in Tokyo with hundreds of infected people on board. Soon afterwards, there was the Ruby Princess, considered one of the worst outbreaks in Australia, with hundreds of cases and 28 deaths linked to that ship. The worsening pandemic meant the whole cruising industry was brought to a standstill. But 2 years later, there are many people who are poised to book their next trip. So what would it take to make cruising safe again? Later, we'll hear what passengers can do to try to stay healthy on board. But first, Casey Briggs joins us. Casey, from the very beginning of the pandemic, the travel industry has really felt the brunt of the disruption.
That's right, Jez. Just a quick look at the ABS border movement data really paints a pretty stark picture of just how dramatic this border closure has been. For the past decade, arrivals and departures into Australia have been slowly but surely growing. That is, until the pandemic began. Let's add the years of the pandemic into this chart. You can see arrivals and departures just plunged to record lows virtually overnight. So there's no prizes for guessing why it is that the tourism industry is so keen to see border restrictions easing on international visitors. In December 2021, on the preliminary numbers we've got, we are already seeing an increase in both arrivals and departures, and they come from all categories of traveller, both Australians returning home as well as overseas visitors and people who are moving to Australia permanently as well. And this, as the border restriction, as the international borders opening up to visitors does approach, we are in a position in Australia where deaths are now finally starting to fall again. We're down now to seeing about 60 to 70 deaths a day, so it is a small and a slow decline, down from where they were at about 80 deaths a day about a week and a half ago. The other thing that we're seeing this week as deaths start to slow down is that we've seen a bit of a spike in cases in a handful of states. So an elevation, a step change, if you like. This is the ACT, where we've seen in the back half of this week just an increase in diagnoses every day. We're seeing the same thing in South Australia as well as a handful of other states. One plausible explanation for this could be the return of schools in most states around the country and the increased surveillance testing that's come along with it. Let me show you an age breakdown of cases across New South Wales, and people 19 or under, they are making up the biggest single share of all infections in New South Wales really consistently at the moment. This data includes both PCR results and rapid tests, including those ones being done in schools. And what we see here this particular day, a big single day increase among children in New South Wales being diagnosed. That coincides with the same day this week in New South Wales that we saw again a step lift in cases across the state. So whether this increase we're seeing in several states translates into an increase in hospitalisations down the track, that's going to depend partly or largely on whether this represents new transmission happening in schools and spreading out through the community, or if it represents really just the fact that we're doing more surveillance testing of kids and perhaps finding more symptomless cases that were going undetected before that surveillance testing was in place. And of course, while the waves of Omicron are receding in most parts of the country, there is one place, one state where really this wave is continuing to worsen. Quite a lot of cases now being found across Western Australia every day. A lot of them related to travel, but a growing wave of local infections as well. Jeremy, the Omicron wave is clearly now growing in the West.
Casey, thank you. Let's get more now on those COVID cases in WA with our reporter Kian Burke. Kian, what have the authorities there had to say?
Jeremy, the big news that we have today is that WA has recorded its second death from a locally acquired case of COVID-19 since the start of the pandemic. The first death was much earlier on in the piece, but unfortunately a man in his 70s has died in hospital here in WA. Authorities say he contracted the virus at a northern suburbs bowling club. He's been in hospital for a number of days, in and out of the ICU, and unfortunately he has lost his life. the Premier, Mark McGowan, pointing out that WA Health has no records of this man being vaccinated. So the message from authorities is really that if you haven't got your jab yet, you absolutely need to, and you have to get your booster as soon as you're eligible and as soon as you can to protect against those rising cases of Omicron here in WA. There were 51 local cases today, a total of 99. That includes 13 cases in overseas travellers and 35 from interstate. So they're all in self-quarantine at the moment. The Premier says that is exactly why he delayed WA's border reopening, so that those cases weren't out in the community, weren't contributing to that growing spread. But nonetheless, he is warning people that Omicron is here. It is in WA. Those cases are increasing. And all we can try and do now is flatten that curve as much as we can. Jeremy?
Thank you. The federal government's ban on the cruise industry is now set to be lifted in April. But even if that does go ahead, it could be a while before any ships will launch from Australian shores. In a moment, we'll be joined by a doctor specialising in travel medicine. But right now, let's hear from Joel Katz, the Australasian Managing Director of the Cruise Lines International Association. Joel Katz, thanks for joining us. We have a new date now, April 17. That's the deadline when cruise ships can potentially leave from Australia. How confident are you that cruising will return from that date?
Good to be with you. Look, we know that cruise lines have long lead times to get back up and running. Most of the cruise lines have now cancelled through to the end of May, so we probably wouldn't see them return until June. So this gives us time to work with the states. We heard from National Cabinet yesterday that the states are committed to working with the industry. So this gives us the time to work with the states, finalise those protocols, get the ban lifted, and let's get those ships back to Australia by the middle of the year.
How important is it for the industry to have a national protocol rather than dealing state by state with how this reopening happens?
So what was encouraging about the announcement yesterday is that Victoria, Queensland and New South Wales are going to work together. Obviously, for cruise ships to offer interesting and exciting itineraries to the passengers, they need to be able to move around. Queensland has the most cruise ports out of any state, and then New South Wales and Victoria have amazing cruise destinations which people love to visit.
How long would it take to get cruise liners back into Australia? It's not really a case of flicking the switch and in they come. There's a lot of lead time involved, isn't there?
Exactly right. Apart from the the physical issues of getting the ship prepared and ready, it's about getting the crew back on board, trained on the new protocols, obviously vaccinated, and then there's the whole supply chain. Cruise ships are very complex operations. Everything from the travel agents, the tour operators, the food and beverage suppliers. Cruise ships use huge amounts of Australian dairy, meat, wine, and we were talking to some farmers who supply the tomatoes that go on the ships. They need to plant the tomatoes well in advance of those ships arriving because of the sheer volumes that they consume.
There's been an enormous reputational hit to cruising, but loyal cruisers are really keen to get back to normal. How much will cruising have changed by the time those people do get to step on board?
Well, the good thing is we've seen cruising restart in 86 countries around the world. More than 7 million passengers have already successfully sailed. And the feedback that they're giving us is that they're still enjoying the amazing experience that cruise offers. They prepare to comply with the really strict and robust protocols that the industry has introduced in order to be able to sail again. They're loving the experience, and many people have already done multiple cruises since cruising has restarted. Here in Australia, before COVID, we had the highest market penetration for cruise in the world. That means more Australians cruise than any other established market. And they're telling us they can't wait to get back at sea.
Despite all the protocols, though, there is one thing you can't guarantee, and that is the risk of transmission on board. If at some stage there is a COVID outbreak, it almost seems inevitable, what would happen?
Well, as we all know, no environment is immune from COVID. So part of the industry's approach is to take a layered approach to dealing with COVID. So firstly, there is prevention. We were the first sector to introduce 100% mandatory testing, which means nobody's getting on board the ship that doesn't first test negative to COVID. Then, of course, there's vaccination. And then when you get on board, there are all the public health measures that you would expect in those social environments. The social distancing, the capacity restrictions in venues, mask wearing where you can't social distance, Behind the scenes, there's the sanitation measures which have been enhanced, the ventilation systems to increase the fresh air. And then to your point, making sure that the response plans are in place to deal with any cases that do still get on board. So having the isolation areas of the ship, being able to quarantine, track, test on board. And then, of course, be able to disembark or medically evacuate those serious cases. But the really positive thing that we've seen in the overseas context is that the incidences of serious cases and hospitalizations on board ships, because of those robust screening and testing and vaccination protocols, are 80 times lower than on land.
Joel Katz, it's good to have you on the program. Thank you.
Thank you.
Let's bring in Dr. Deb Mills, a travel medicine expert. She joins us now. Dr. Mills, welcome back to The Virus. Now, people have a lot of opinions about cruises. As a doctor, we've just heard about the risk of serious illness and transmission on board a cruise ship. What should a potential passenger think about before they book one of these trips?
Well, look, the main thing to remember is that cruising is now safer than it has ever been. All these precautions are doing wonders for the risk of other diseases, like influenza was a real problem on cruises. 1% of travellers get influenza, and it was just notorious that there would be cruise lines where the boats would be basically moving the flu from cruise to cruise between the passengers and the staff. It was a terrible problem. Now, this sort of problem is going to go away because of all these lovely measures that have just been described. So I think the cruise is doing the right thing, and now it's up to the passengers to do the right thing. And that means things like making sure their medical care is stable, that they don't have any problems that are brewing, don't get on the boat sick, whether it's gastro illnesses, respiratory illnesses, that will be stopped by a lot of the testing. But once you get on the boat, the systems are not great for treating complicated things. You need to have them dealt with before you go. People need to have their vaccines, and everyone is obsessed with COVID vaccine. But in fact, measles spreads on cruise ships. Chickenpox spreads on cruise ships. And some of the staff, come from countries where these diseases may be more common than Australia. So it's very important that people have their routine childhood vaccines, things like their measles vaccine, which is not always the case. People think, oh, all my shots are done. Well, they're not always done. You need to check that. Having an influenza vaccine before you go, taking a little medical kit with your emergency supplies, and being prepared for things like pain and wounds, having lots of sunscreen and insect repellent, and their normal medications. One of the common reasons that people go to the ship's doctor is that they've forgotten to bring their normal medications with you. The thing that's really surprising when you're actually on the cruise is the most common reason people present to the cruise medical centre is respiratory illness, but the second one is falls. Many of the people are not familiar with walking around on boats, which might, sometimes wobble or have narrow stairs. And so it's very important that people are cautious with falls, and particularly alcohol increases the risk of falls. So people, need to indulge and have a good time and eat and drink and be merry, but they kind of need to keep a little bit of a devil on their shoulder and make sure that they're not overindulging, because there have been disasters where people have fallen off the boat because they've had too much alcohol and so on. So they really need to be careful with alcohol, excess food. Things like buffets have always been a worry, and now they're pretty much gone. You can't trust, that sort of environment for food serving. So they're making it's making cruising much safer. And one of the tips I always like to give people is, if you can, use your own bathroom. Norovirus has always been an issue on cruises, and it's a very hard thing to clean properly to decrease the risk of norovirus. Now the protocols are much stricter, and so that will be much less of a problem. But if you can use your own bathroom, then you know that it's very clean and no one's been in there kind of accidentally having accidents.
For people who are planning a trip and planning their booster shot, is it worth timing one towards the other?
You certainly want to have the booster at least 2 weeks before you depart, because the vaccine takes 2 weeks to work. You wouldn't want to have it the day you step on the cruise. But, if your booster's due, you should have it. It's not really worth sort of waiting to see if the booster can be a bit more effective when you're just getting on the boat, because the boosters work very, very well.
Dr. Deb Mills, great to have you on the program. Thank you.
Always a pleasure.
And that is the show for this week. Thanks for your company from all of us. Bye for now.